When I hear about people reaching plateau, I'll usually tell them that it's normal to have that experience. The average patient that comes in to see me will be either obese with hypertension or just slightly overweight with other medical problems, prediabetes, polycystic ovarian syndrome, symptoms of depression, or even hypothyroidism, high cholesterol, all of the above. But regardless, the idea is when you've made a major lifestyle change, we have to try to maintain that lifestyle change. So the weight loss programs that we have at First Health Associates will usually help to manifest some form of change that you haven't thought about before and then get you on your way. Our longest program in a group is a 12-week program called The Largest Loser. And we usually have very good results with The Largest Loser, and sometimes we'll have patients come back because they fall off the wagon. That's very normal. It's easy to go back into bad habit, especially during times of stress. So when we have somebody that is maintaining a very tight caloric restriction, maintaining a very good activity level, but yet gaining weight or having problems with plateauing, they're not losing fast enough or they stop losing at all, then the idea would be let's reassess how we got to this point. Sometimes if I have patients coming in from outside the office, I'll reassess. I want them to send in or bring in their blood tests so I can review. Just because a doctor says you don't have thyroid disease, for example, or don't have any deficiency in vitamin B12 doesn't mean that I would agree personally. And again, I've been trained by one of the best institutions in the world, the University of Arizona. And I think that the things that we take into account are sometimes a little bit different than what you find in a regular medical school. Medical school gives us about 2 weeks to 4 weeks of nutrition training, and that's about it as a physician. So if I'm going to tell anybody how to make a lifestyle change, I'll do it with what I know best. And if I was a standard doctor, I would probably be prescribing medicines or considering obesity surgery. If I'm who I am now, then I embrace nutrition, relaxation therapy, and exercise of some sort. So the bottom line is, with regards to plateauing, looking at diseases like the thyroid, checking a full thyroid panel, and you can look into my thyroid lecture, looking into adrenal fatigue or cortisol deficiency, looking into allergies to food. Some of the easiest things would be if it's an eating disorder, we're just having a little bit of a flare-up in controlling eating habit just for a short time, say with a couple of weeks of stress, then maybe phentermine, if all other medical problems are ruled out, maybe phentermine would be important just to get past that point. Using phentermine, which is an appetite suppressant, is helpful, but if you go straight to phentermine and not teach nutrition, exercise, or mind-body medicine, then you're going to be stuck on phentermine. In fact, you'll gain more weight after stopping phentermine because in the long run, it is a dangerous drug. It causes fast heart rate and high blood pressure, so it's not meant to be used for a long haul. It's meant to get you past plateau. It's just like, say, if you're hypothyroid with symptoms of dry skin, weight gain, depression, constipation, falling hair, if the blood tests all look negative or normal, yet you're manifesting all the symptoms and no other disease process is present or found to be present, then sometimes getting you past the plateau point would be using thyroid supplement for a short amount of time. Again, always embracing nutrition, exercise, and mind-body medicine. Looking for levels of inflammation, looking for and analyzing how much sleep a patient is getting would be important. If I have somebody that's requiring 1 cup of coffee, large, in the morning, and or that with a double shot of espresso or anything further, that would tell me that that person's fatigued, and if they're fatigued, they're probably not getting enough sleep. If exercise is done at night, same thing. If you have no choice, then try to stop or finish the exercise with a relaxation program. It sounds backwards, but instead of going and warming up, then hitting the highest amount of breath and then going home, try to start out really aggressive, high heart rate, and then wind down by the end of your exercise routine. Yoga, breathing exercises, or stretching. Hopefully you don't injure yourself, but again, that would be the way to dovetail into a proper sleep. If you're doing all that at the expense of sleep, you're going to take more stimulants. With stimulants in the morning, although they wake you up, you're going to crash. The body's very good at maintaining homeostasis, so when it gets that much stimulation, it'll also reverse it too. You'll crash at 11, you'll start hunting for food. Not good in the long run. And that's not a well-balanced life either. You can't maintain that without maybe getting back into your old habits again. So trying to reestablish, if you've hit a plateau, try to reestablish, see what is failing, see what you're relying on, see if you're happy with your food, if you're content with your exercise routine. If you can't self-analyze, then get somebody else, a coach, to kind of take apart your program and see where it can get some assistance. If it can't and you've maximized and your coaches say that's about it, he's doing everything great, then you come to one of us and then we see about getting you past plateau with prescription medicines if necessary, or just maximizing on nutrition. Rhodiola, excellent stimulant, very good antioxidant, proper sleep at night with valerian, melatonin, taking care of inflammation with turmeric, taking care of joint pains that are flared up with glucosamine sulfate, just maximizing on B12 if you haven't done that, vitamin D. So there's many things that can be done, but you're going to have somebody kind of take apart your history, look at all the blood tests that were done, and then kind of reassess and get you past the plateau into your next endeavor. And it's okay to have a plateau, but it's not okay just to go back to the old habits after having attained such good results. So don't waste it. Keep on utilizing it and reformulate a new you to get to the point of sustainability.